seeing as how you pointed out with these new maps that the BC CDC is releasing today, that as we know, there are some parts of the province that are seeing higher levels of community transmission and some that are seeing a lot lower. As you get ready for schools to open, are you recommending that any extra resources or different policies or caps on class sizes be put into place in any of these areas with higher community transmission?
Yeah, so what we look at, and I think the map is a good example of that, how our convention is to report cases by their place of residence. So it doesn't necessarily reflect where they have picked up the virus, where they've been exposed. So many of these cases were related to travel. We still get travel-related cases. And many of the cases may be that you worked in one place and live in another place. Having said that, across the province, our rates of prevalence of the virus, so the number of people who are positive per 1,000 population, are very low, and relative to any other jurisdiction in the world. As well, our rates of new cases, our incidence of numbers of cases per 100,000 population are also very low. And there have been some standards that have been put out by other organizations, and those are things that we're watching. We watch, how much virus is circulating in our community, how much of it is known, where we know the exposures, we know the risks. We've identified somebody and they become ill when they've been in isolation or quarantine so that they're not passing it on to others. And that remains very high. So we still are finding people quickly. We are linking people quickly. Less than 20% of our cases are unlinked, and those are the ones that talk to us about community spread that we're not aware of, and we investigate those very carefully. So all of those markers everywhere in our province are very low, and we will continue to watch them. So what that means is that the parameters that we've put in place from a public health perspective in schools across this province are still valid, and they're the ones that will work no matter what we're seeing, and we will continue to watch the community spread and take whatever measures we need to ensure that schools and workplaces and our communities are protected. I think the other really important thing as we're moving into September and schools going back is that what happens in schools, and we've seen this around the world, what happens in schools reflects what's happening in the community. So we have very low level of spread or no spread in most communities here in BC. And even in those communities where we have some community connections and spread, it's still at a very low level. And we expect to see that in our schools. And this is a very challenging time, and we in public health will be there with every school in this province to make sure that we have a response, that we identify children or adults in the school setting early, and that we have the things in place that we need to make sure that we're doing everything to prevent transmission.
Do you have a follow-up, Kelly?
I do. I know you've spoken before about the sort of dry run that BC did in June and how well that went. Even though prevalence and incidence is still quite low compared to other parts of the world, it is quite a bit higher than it was in BC in June, if I understand right. So are you still feeling as confident that June experiment is a sort of useful predictor of what will happen now that there are more cases than there were then?
I think there's a couple things from that. We learned really practical, operational things, what works, what doesn't work, about how to do things in the school system. And my hat goes off to the teachers, the educators, the principals, the parents in every school in this province who have been taking that information, looking at their own school and coming up with the plans that will make it work. And if we look around the world, there's millions of children who are going back to school. Scotland went back last week. We've been watching what's happening in places like Denmark and Finland. We've been watching Germany. So yes, we do think that we have what's in place now to do this safely, and that we'll be there, and there'll be there's very likely there's going to be cases because we have a low level of transmission. So how do we make sure that we're doing everything we can to minimize that, and that we're managing them quickly and efficiently? And we've shown that we can do that. because this is a long-term thing. We are living with this virus for a long time. So we need to work together. We need to use our innovation and our imagination, and we need to work with kids and with the adults in our schools. And we will do that, and we'll get through this, and we will be able to manage it. And I think that's one of the things that we learned from June. That, we've had introductions into the school with people who had COVID, and we were able to manage it. And we managed it quickly and efficiently without transmissions.